As promised, this is the one show where we talk about your health in the best way that we can. Welcome to Formula U. Today we're looking at prostate health, understanding, preventing, and maintaining prostate conditions. Chinwe Blessing, and of course, we're going to be having a conversation today. Last week, we looked at these issues from the perspective of a layman, myself, and today we are going to be looking at it from the perspective of a professional. We have a professional joining us to talk about the common prostate conditions like benign prostatic hyperplasia, prostatitis, and the importance of early detection and treatment for prostate cancer. Our goal is to empower you with knowledge and equip you with the tools to make informed decisions about your prostate health. Now, beyond understanding the conditions, we'll explore preventive measures such as your life choices, nutrition, exercise, stress management that can significantly impact your prostate health. Joining us to have this very interesting conversation via, of course, our phone lines is no other person but Dr. Peter Otto-Obong. Dr. Peters Otto-Obong, he's a member of the West African College of Surgeons. He's a senior registrar, urology division, University of Port Harcourt Teaching Hospital, all the way from Port Harcourt. Good afternoon, sir.
Yeah, good afternoon.
Okay, I think we're having a little bit of a.
Hello.
Let me try to do a callback immediately so that we can get across to you. I think the network isn't being so friendly right now. Stay with us while we try to fix that real quick. We'll be right back.
Check this out!
Voice of the People, 96.1 FM, Abuja. Now.
Here we go. My name is Jesse. My name is Adam. We're from Ben Maroon 5.
Today's hit music. I-93.
VOP 96.1 FM.
We'll be right back in a second, so don't touch that dial.
Check out our show schedule online for information on what's coming up.
Voice of the People, 96.1 FM. Now, you have a voice.
Shugaban ƙasa ya cire tallafin man fetur wanda a turance ake kira da subsidy.
Family times with delicious juicy toppings. Remember, the true happiness comes at special moments, and sometimes you don't wait for it. You simply ask for it. Ask for Romeo's Pizza. It comes in different toppings with delicious fillings you can resist. Have a pizza for meal with Romeo's Pizza. Every bite is nice. Every slice brings a smile that helps you come alive. Romeo, the pizza champion. Light up your...
And we're back. I hope that we have sorted it out completely. Doctor, can you hear us?
Yes, very loud and clear.
Now this is a lot better. Thank you very much for joining us on the show today. We are looking into the issue of prostate health, understanding and preventing, managing prostate conditions. Now, you're a urologist. Could you quickly explain to us what that entails?
Okay, so I prefer to keep things as simple as possible. So in the course of the discussion, we'll talk on the risk factors and the possible symptoms and how we can tackle it. So I think that will help to create enough awareness. on the
Okay.
subject matter.
Okay.
Okay. So, I think I should just highlight on what prostate is, because we don't hear prostate issues and so on, but we don't really know what the prostate is.
Sure.
So this prostate is a very small chestnut-shaped organ that lies in the pelvis. The pelvis is the part of the body that lies below the tummy. Okay?
Yes.
So it has two basic functions, and studies have shown that the prostate is shown to increase in size with age in men. Okay? So now, what does the prostate do? Now, one of the things the prostate does, let me just highlight the basic function first. The thing the prostate does is to secrete what we call prostatic fluid, okay, into semen. Semen is what everybody knows as sperm. That's what you release from the body following ejaculation. Okay, so most of the content of that semen is what we call prostatic fluid, and it contains things like substances that help to sustain the sperm. That's why the sperm can stay outside the body, in the female body, genital tract for up to 3 to 5 days. So that's basically from the content of this prostatic fluid. Okay, so the second thing is that it transmits the urethra. Okay, so that brings us to our topic for today. The urethra is a pipe that carries urine from the bladder, which stores urine to the outside. Okay, now part of that pipe passes through the prostate. So that's the part of the body that stores urine. Okay, now as the prostate begins to grow, it tends to compress that part, so making someone to develop difficulty in urinating. So I hope that's clear enough.
Sure, it sounds very clear.
Okay, so now I said the two basic functions. One is to secrete the prostatic fluid into sperm to keep it, and the second is to transmit this prostatic urethra. Okay.
Yes.
So because if it enlarges in size, it will tend to narrow it and make someone have difficulty in peeing. Okay, so let's look at the risk factors.
Okay, just before we get to the risk factors, I do have a follow-up for you right there. You said as the prostate continues to enlarge, is it natural for the prostate to enlarge? Is it a natural thing or is it a condition?
Yes. Okay, so that brings us to the concept. Okay, so now studies have shown that with aging is a major risk factor for prostate enlargement. So studies have shown that with age, some form of hyperplasia occurs in the prostate gland and to enlarge in size. Okay?
Yes, sir.
So now the degree of enlargement has in different people, because there are a lot of factors that are working for the enlargement and against the enlargement. Okay? So now it all depends on if there is a balance in the particular human being. For instance, you can have a 70-year-old man with a small size prostate. Okay, so usually once the prostate is bigger than 25 grams, we say it's enlarged. Okay, so let me use that as our baseline. So sometimes you can have a 70-year-old with a prostate volume of 30 grams, and sometimes you can have a 50-year-old with a prostate volume of 150 grams, 200 grams, and so on. Okay, so like I said, there will be a balance between the factors that are trying to create the enlargement, factors that try to resist the enlargement. So, but the basic thing is that studies have shown that the prostate increases in size with age. However, the size of the prostate does not correlate with symptoms, in the sense that someone can have a very large prostate and is walking about without symptoms. If such a person comes to us, we don't treat. Okay. Because there is no symptoms. So, but I think some other person can have very small prostate, as small as 25 grams, and then it can't even pee. All right. So I think I've been able to address that.
Absolutely have. What are the common prostate conditions that men may encounter as they age, and what are the symptoms associated with them?
All right. Okay. So commonly, we know we have what's called the benign prostate enlargement. Okay. So that basically means that the prostate is enlarged, or what you have is not the cancerous type. You know, there's a spectrum of prostatic conditions. We have the benign conditions, that's the non-cancerous. we have the malignant prostate diseases, which is a cancerous type. Okay. So I think I should just give us a tip of what cancer is. So, cancer is basically an abnormal growth in the body that is capable of spread. All right. So I think we should take note of that. So now, there's a spectrum of prostate diseases from the benign, like I said, the non-cancerous, down to the cancerous type. So we have the benign prostate enlargement. That means a man comes down with prostate enlargement, but is not cancer. Okay. And then we have the prostate cancer, means someone has prostate enlargement that is capable of abnormal growth in the prostate that is capable of spread to other prostate. We call that one prostate cancer. Then there is also what we call prostatitis. So that's basically an inflammatory condition in the prostate, or some people might just summarize it as infection of the prostate. Okay, so each of these three common conditions can cause what we call lower urinary tract symptoms, can cause those worrisome difficulty urinating, basically. So there are still some other rare conditions that can occur in the prostate, like tuberculosis. Of course, tuberculosis can occur in any part of the body. So you've seen a few cases of TB of the prostate, and then schistosomiasis can also occur in the prostate. Sometimes you can find stones within the prostate. We call that prostate calcium. And then sometimes, as a result of poorly treated infection of the prostate, as a prostatitis, you have an abscess, like pus, inside the prostate. So this is just the spectrum of prostate conditions you can have. So what they share in common is that each of them can present with difficulty in urinating. So it's left to us to find out which is the problem, which is the underlying cause.
Okay. So would you say at what point should a male see a doctor regarding his prostates? At what point would you say, oh, you should actually see a doctor?
Okay, so said earlier that the prostate has been shown to increase in size with age. So following research, it has been found that from the age of 40 and above, commonly, these hyperplasia may occur in the prostate. So usually, the consensus that from the age of 40, men should start doing what we call a prostate cancer screening. Okay, so you go to the hospital and then be seen by a urologist, and then a hormone is checked. We call that prostate specific antigen. So now, when the levels of these particular hormones exceed a particular level, it could be suspicious for prostate cancer. All right. So, but basically, any male, irrespective of the age, with any symptom that has to do with a urologic condition, for instance, lower urinary tract symptoms, I think we're going to discuss them one after the other.
Okay.
So that person has met the criteria to see a urologist.
Okay.
Okay, so
go ahead.
I think we should just let me just highlight the symptoms.
Okay, great.
Okay, so there's what we call lower urinary tract symptoms. Like I said, it encompasses difficulty urinating. Okay, so that could be from any of the spectrum of diseases of the prostate. Like I said, all of them can cause it. Okay. So they include urinary frequency. Okay. No. Now somebody goes to pee, and then within 2 hours the person has the urge to pee again. Okay. And then somebody who gets to pee within 2 hours after the previous urination. We call that urinary frequency. We also have what we call nocturia. That means you get to wake up more than 2 times at night to pee. That's nocturia. That's also a lower urinary tract symptom. And then there's also what we call urgency. Urgency is basically, inability to postpone urination. Someone is pressed and begins to feel like if he doesn't go to the toilet right now, the pee might just come out by itself. Okay, so these first three I mentioned are what we call irritative symptoms or the storage symptoms. Okay. So also the one we call voiding symptoms, and they include weak stream. Someone gets to pee and it doesn't flow straight. The pee cannot drill a hole in the sand. Okay, so we call that weak stream. We also have intermittency where the patient gets to pee and then the pee involuntarily stops by itself and starts again. That's also an obstructive symptom. And then there's also the feeling of incomplete emptying where someone begins to feel that after peeing, you feel like something is still left behind. You didn't completely empty your bladder. Okay, so these are some of the common lower urinary tract symptoms you can see. So for prostate cancer specifically, the symptom will depend on the stage of the disease. For instance, if the prostate cancer is localized to the prostate, okay, you can have these other symptoms I just talked about, the lower urinary tract symptoms I just talked about, both the irritative, the storage and the voiding symptoms. Okay. Now, if the cancer begins to spread just outside the prostate, okay, we can have some symptoms like hematostemia. Someone after ejaculation, he sees blood in sperm. Okay. You could have something like hematuria, that's passage of blood in urine.
Okay.
And then sometimes we could have what we call pelvic pain. That's when the prostate cancer spreads to some of the nerves in the pelvis, that area of the body that lies below the tummy I talked about earlier.
Yeah.
So someone can develop to have these lower abdominal pain in that area.
Okay.
So if the spread is maybe far beyond the prostate, that we call this one metastatic disease, the patient will develop symptoms of that particular of the organ of pathology. For instance, the commonest site of spread of prostate is the spine. Okay, so someone will have low back pain. Okay, so the peculiarity of the low back pain from prostate cancer is that it is usually accompanied by weakness of the legs or inability to move the legs or inability to walk.
Okay.
Because the cancer will affect the spinal roots, that is nerves that come from the spinal cord that supply the legs are affected. Okay, and it could also spread to the brain. Okay, so we see an elderly man that has dementia of unknown cause. Sometimes it could be prostate cancer that has spread to the brain. Okay, and it could spread to the liver. Someone develops jaundice, other signs of liver failure. It could spread to the lung. It could spread to the lymph nodes. Sometimes if the lymph nodes are involved, someone can develop what we call lymphedema of the lower limb as the leg begins to swell. Okay, so I think that's just the spectrum for the prostate cancer. So
All right. Now, this question has come up. It came up the last time we tried to talk about it, and I made it a point of note to ask today. How can individuals promote and maintain a healthy prostate through lifestyle choices, including your diet and exercise?
Okay. So that brings us down to the concept of risk factors. A risk factor is basically anything that increases your chances of developing a disease. Okay?
Yes, sir.
So several studies have been done, and then they came up with a consensus on the modifiable and non-modifiable risk factors. So those modifiable risk factors means that you can adjust your lifestyle to reduce your risk of coming down with this prostate cancer and disease. Okay?
Yeah.
And then there's also the non-modifiable, which of course, there's nothing you can do about at once.
Yeah.
So let me start with the non-modifiable. Okay, so for prostate cancer now, typically, of course, if you are a male, of course, females don't have prostate, so they can't come down with prostate cancer.
Yeah.
Once you are a male, yes, once you are a male, it means even if it's 0.001%, the risk of coming down with prostate cancer is there. One.
Yeah.
Then two, age. I said earlier that the older you are, the higher your chances of coming down with prostate cancer.
Yeah.
Okay. So that's another concept there is that prostate cancer that occurs in patients above 70 usually follows a milder course.
Okay.
Okay. Compared to those ones that occur in patients less than the age of 50. Those ones are usually more aggressive. But generally, prostate cancer is not as aggressive as other cancers in the body. It follows an endocrine cause, a slow-growing tumor. Okay. Now, that also brings us to family history is something else under the unmodifiable risk factors. There's what we call the first degree relative. So if your father has prostate cancer, your brother has prostate cancer, or your son has prostate cancer, so the chances of you coming down with this prostate cancer is actually very high. And then studies have also shown that in the black race, the higher risk of coming down with prostate cancer compared with the whites. Okay. So for these of course, the studies have shown that 1 out of every 4 to 6 blacks will be diagnosed of prostate cancer in their lifetime. Okay, so it has actually been shown to be commoner in black. So just like I mentioned earlier about the aggressiveness. Now, it's only 1 out of 12 people with prostate cancer that have been shown that will actually die from prostate cancer. Okay. So that means the other 11 with prostate cancer will not die from prostate cancer; they will die from other causes. That also supports the hypothesis that prostate cancer is not as aggressive as the other forms of cancer. Okay, so the modifiable risk factors, I think we'll start with saturated fat, because commonly we consume a lot of saturated fat in this part of the country. Okay?
Yes.
Or this part of the world.
Of the world.
So now, what's saturated fat? All oils and fats that at room temperature become solid, means it's not safe for the body. So palm oil, red oil, they all fall into that category.
Wow.
Okay. Yes. So the reason being that the fat actually increases the chances of someone having higher male hormones in the body. And then it also increases the chances of production of carcinogens. Carcinogens are substances that can turn a normal cell into cancer cell. Okay?
Sorry, could you go over that again? Could you go over that again? We lost you for a little second there.
Okay, there are several reasons why saturated fat is implicated in prostate cancer. So one, it increases the concentration of male hormones in the body. I said the male hormone is the testosterone. Okay?
Yes.
And then it has been shown to be, the diet of this prostate cancer. It has been also implicated in the cause of prostate cancer. Okay. So that's for cases that are advanced, what we do is to deprive the body of testosterone and then you increase prostate cancer cells. Okay, so this saturated fat increases the amount of male hormones. Okay, that's one. And the other one, I also said that it increases the chances of having carcinogens in the prostate. Okay. Now, these carcinogens are anything that can convert the normal prostate cancer cells to the what you call the cancer cells. All right.
Yeah.
So that's why saturated fat is not advised. So, however, unsaturated fat is safe. Things like olive oil, okay, is safe. So now, red meat, of course, red meat also contains fat.
Okay.
So it's also been said to be a risk factor for development of prostate cancer.
Wow.
And then obesity has also been implicated. These people who are very fat,
Yes.
But to be more objective, is what we call body mass index, where we check your weight and divide by your height times 2.
Yeah.
Okay. So we have a normal value for it. If you see a particular value, we now say the person is obese. Okay. But the common knowledge is that somebody who is excessively fat has obesity. So that has also been to be a risk factor. Smoking and alcohol have also been shown to be risk factors.
Okay.
For prostate. Yes. So we advocate that we tone down on consumption of these things. So another important concept is sexual activity.
Yeah.
Okay. Now, in the spectrum, on one end, it has been shown that increased sexual activity actually reduces your chances of coming down with prostate cancer. The reason being that those carcinogens talked about that are produced from anaerobic metabolism, that's the prostate. What they normally do is that during ejaculation, they are being free. They follow the semen and go out of the body. Okay, they don't have enough time to stay in the prostate and cause a malignant transformation.
Okay.
So that's why we advocate frequent sexual intercourse for men.
Okay.
So now on the other part, on the other spectrum, some viruses have been shown to be carcinogens, that to cause prostate cancer. Like there's what we call herpes type 2 virus, is sexually transmitted.
Okay.
And then there's also the human papilloma virus, which is sexually transmitted. So these viruses have been shown to be carcinogens. So people who have multiple sex partners, unprotected sex, particularly, have a higher risk of coming down with prostate cancer from this.
Okay. I mean, very interesting fact you just put out there. I'm sure that lots of the men right now are looking at their partners and saying, you have a way of saving me from probably going down with prostate cancer. We just have to keep being sexually active. Well, let's find out. Can you explain the various screening methods that are available for prostate conditions? And of course, please, while you're at that, help us out with the importance of early detection.
Sorry, I didn't get the importance of what? The last thing.
Okay, the importance of early detection of any of these conditions.
Okay.
Yeah.
Okay. So let me start with that. The importance of early detection is that for using prostate cancer, for instance, if prostate cancer is actually organ confined, if you localize to the prostate, you can actually cure it by doing what we call a radical prostatectomy, where the prostate is removed. So now there are newer methods where you don't have to cut through somebody. You can actually use some equipment. We call them laparoscopic surgery. Where it's less invasive compared to the other. So now the aim of early detection is that you can actually cure this prostate. Detect it on time. So that's why we advocate for screening. The advocation for screening comes because of the fact that if you detect it early, you can actually bring the process. So, but one of the challenges we face in this part of the world is that the attitude towards the health-seeking behavior in men is actually poor. So most of the patients we see come in either the locally advanced or the advanced. That means the disease is no longer confined to the prostate. So, but once it gets to that extent, so at that point, we just resort to palliative care. We cannot guarantee cure for the patient. So now, the screening methods, commonly, there are several ways you can screen, You could screen a patient clinically where someone comes to the hospital and then following a history, taking a lot of questions. You can actually see this patient has a high chance of having prostate cancer. Sometimes you also examine patients. We do what we call the digital rectal examination, where you assess the prostate and feel how it feels like, if it's cancerous or if it feels benign. So that could also be a form of screening. Then you have what we call the laboratory screening, where we check for PSA, and that's the universal screening method. So we check for blood, the blood samples are collected and then tested for this hormone, the prostate-specific antigen, we call it PSA. So the reference range for most laboratories is 0 to 4. So once the value starts to exceed this particular reference range, that means there's a chance that the patient may have prostate cancer. So what we now do in that case is that we do a confirmatory test, which is a biopsy.
All right, doctor. Just in closing, because we have about 2 minutes to do that on the show, what is your general advice to the everyday man walking on the streets of Nigeria as regards to his prostate health?
Well, the basic advice is that we should, number one, improve your health-seeking behavior. Okay, because statistics have even shown that the what we call the mortality in men, age for age, is actually higher compared to females. So one of the reasons is because the health-seeking behavior is poorer in men compared to women. And basically, I think the basic thing is just that we should just seek medical advice.
All right. Thank you very much, Dr. Otto Obong Peters, for this very, very educative segment. We're really grateful for your time.
Thank you for having me.
All right, great. We've had a conversation about preventing, managing, understanding prostate conditions, and we've had this conversation with Dr. Otto Obong Peters, a member of the West African College of Surgeons and Senior Registrar, Urology Division, University of Port Harcourt Teaching Hospital in Port Harcourt. He joined us via the phone lines. It's been a very, very educative segment, and that brings us to the end of today's episode on prostate health. Understanding, preventing, and like I said, managing prostate conditions. I hope you've enjoyed our deep dive into this important topic. Remember, your prostate health is essential for your overall well-being. Stay informed, prioritize regular checkups, like the doctor said, and make your health a top priority. Thank you so much for your educative insights. Like I said, Dr. Otto Obong Peters, don't forget, you can join us next time as we continue to explore fascinating subjects right here on Formula U on Matters. Until then, take care of yourself, be proactive about your health, and keep tuning in for more engaging discussions. And just before I leave, you can find all episodes of Formula U and every other program of Voice of the People, Abuja, on YouTube on Voice of the People 96.1 FM Abuja. I'm Chinwe Blessing. I'm going to take a breather. When we come back on Industry, it's very interesting findings all the way from the world of Disney. Some chilling revelations that might just make you question what you are exposing your children to. Don't go anywhere. Promises to be exciting.